Good evening, and thank you for joining today's virtual town hall. All participants are muted. If you have a question, please use the chat feature. Questions will be addressed by our moderator and presented to the panelists. To get us started, I would like to introduce the Partnership for Drug-Free New Jersey's Director of Opioid Response and Prevention Outreach, Angela Conover. Angela.
Thanks, Greg. Good evening, everyone, and thank you for joining us for this Knock Out Opioid Abuse Town Hall for the Bayshore area. So pleased that all of you took the time out this evening, and especially thankful for our esteemed panelists who have taken the time to join us today to talk about this very important issue. This town hall series is part of a program with the Horizon Foundation of New Jersey, and we want to welcome Dr. David Bush from Horizon Blue Cross Blue Shield of New Jersey to say a few words of welcome. Dr. Bush.
Thank you, Angela, and good evening to everyone. This is a really important topic for me professionally and personally. I'm an addiction doc in addition to my work with Horizon. It's my honor to join you this evening. I would like to thank all of you for your interest and attendance tonight. I know this is a very challenging time for everyone, and we greatly appreciate your dedication to continuing the discussion on how we can knock out opioid abuse in New Jersey, especially at this critical time. As many of you are aware, due to COVID-19, the Partnership for Drug-Free New Jersey has had to cancel in-person town halls. But thank you all for showing up tonight. The Horizon Foundation has been working with the partnership to develop new ways to continue the conversation and to continue community engagement through social media and through the partnership's website. Tonight's event is the third of our 4 virtual town halls being held over several weeks, which will focus on the opioid crisis at the individual community level. Horizon, through its philanthropic arm, the Horizon Foundation for New Jersey, is extremely proud of our collaboration with the Partnership for Drug-Free New Jersey to bring you today's webinar through the Knock Out Abuse Initiative. The initiative is part of our company-wide response to address and help end this public health crisis across our state and across our families and communities, and it represents a large portion of the foundation's $1.8 million Horizon Blue Cross Blue Shield has invested to provide support for opioid prevention and education programs to help families and our members in our communities. In closing, I want to thank the wonderful people who are participating tonight, Police Chief Whitkey for your opening remarks, Pastor Barry Mulligan for moderating, and also I would really like to thank Freeholder Deputy Director Kiley, Dr. Reynolds, Dr. Ridley, Philip, and Ellen for presenting tonight. I would also like to give a special thanks to the Monmouth County Prosecutor's Office, Hazlitt Alliance, Hazlitt's Hope Network, and Hazlitt Township Public Schools for collaborating with us on this webinar, and especially to the Partnership for a Drug-Free New Jersey team for putting this important webinar together. These are great people. Together we can make a positive difference in combating this epidemic, and thank you very much.
Thanks so much, Dr. Bush, and thank you for your support and the support of the Horizon Foundation and Blue Cross Blue Shield of New Jersey. Appreciate all that you have done for us, and also thank you for mentioning that this event was initially scheduled for March and was postponed and switched to a virtual event due to the COVID pandemic. And now I am pleased to welcome Chief Ted Whitkey from Hazlitt Township. Chief.
Thanks for having me tonight. I'm truly honored to have this opportunity. I'd like to say good evening, Bayshore community. I'm Ted Whitkey, Chief of Police, Hazlitt Township. I'd like to thank Partnership for Drug-Free New Jersey and also Horizon for sponsoring this virtual town hall event. And I'll say this: I'm no expert on opioids, but I do have 22 years experience seeing the effects that opioids have had on our community. As you know, drug use, it's ever evolving. And we as a community, we have to stay current on the trends so we can develop, a proper course of action in order to combat it. In the late 1990s and early 2000s, early on in my career, I saw the effects of crack cocaine on our community. And then after that, I witnessed the start of the rise in heroin and prescription painkillers that were pushed by, unscrupulous doctors. And once the crackdown started on prescriptions, we saw a real emergence of heroin. And now over the last few years, we witnessed the addition of fentanyl, which has made it an even deadlier combination. And in my career, never have I seen the amount of overdose deaths that we have with heroin and fentanyl today. From a law enforcement perspective, we've come to, the realization that we can't solve this epidemic with enforcement alone. In order for us to really make an impact, we have to work together with all of our stakeholders and use what I like to call like a whole community approach. That's why in the town of Hazlet, we have focused our efforts on 3 key areas, and we're currently focusing in these areas: education, intervention, and enforcement. With the education, we partnered with our school district to re-implement our drug awareness programs to our district and really reach out to our youth. When we look at the intervention part, this is one of the most important pieces, and until recently, we weren't able to fill that void.
Chief, I think we may have lost you.
Can you hear me?
I think we can hear you now. Thank you.
I'm sorry. I was saying, we focus on education, intervention, and enforcement, and when we look at the intervention part, it's one of the most important pieces that I think, was missing up to a couple years ago when we partnered with Hazlet's Hope Network, and with them as one of our partners, it gives us the ability to really assist people when we come in contact with them, and hopefully stop the revolving door through the criminal justice system. And then lastly, the enforcement part of it, we're continuing to enforce the drug laws, but we're further concentrating those efforts towards the dealers who are supplying our residents with these drugs. And just to sum it all up, we have to continue to monitor our successes and failures of these implementations, and we'll continue to make adjustments. And we also have to continue to think outside the box as a community, and the way we do that is to continue to have events like this. Sharing experiences and brainstorming of ideas is really how we'll save more lives and put our residents back on a path of recovery. I want to thank all of you for your time and hope that everyone takes away something from this important virtual event. Thank you again.
Thanks so much, Chief. And you're right. Only by having these conversations and continuing to see what is happening in our communities, we'll be able to move forward in addressing this crisis. So appreciate you being here. Appreciate your support. Appreciate the support of all of our collaborators on this evening's event, including Hazlet Hope, who has done so much of the planning for this event. But now it's my pleasure to turn over the event to our moderator, Pastor Barry Mulligan from the Hazlet Bible Church. Pastor, thank you so much for being our moderator this evening.
Oh, thank you, Angela. I appreciate it. Good evening. My name is Barry Mulligan, Senior Pastor of Hazlet Bible Church. I've been serving as a community liaison with the Hazlet's Hope Network for just about 3 years now. And for tonight, I've been invited to serve as your moderator. In addition to being a pastoral resource and praying for those on the front line of this issue, I facilitate a monthly family support group meeting. It is designed to give the parents and family members of those struggling with addiction a place to share their burdens and find encouragement. And as they interact with other family members, they are interacting with those who know exactly what it is to live through this ordeal. So on behalf of those who have worked so hard to bring this town hall meeting together, we welcome you again and thank you for joining us. With us tonight, we have 5 panelists. Each person comes to this issue with his or her own experience and perspective, and they represent the various spheres of life that are impacted by the opiate situation in our region. So let me introduce them to you. We have Dr. Stephanie Reynolds, who works in emergency medicine at Riverview Medical Center. Deputy Director Sue Kiley, an elected official with the Monmouth County Board of Chosen Freeholders. Phil O'Hara, treatment liaison for Hazlet's Hope Network. Dr. Scott Ridley is the superintendent of Hazlet Township Public Schools. And Ellen Edwards, a parent and board member of Hazlet's Hope Network. To get started, I have a specific question for each of the panelists, beginning with Dr. Reynolds. Dr. Reynolds, how has the opioid epidemic reached to this level, and what has the medical community done to address it?
Thank you, Pastor Barry. First, I want to thank Horizon and the Partnership for Drug-Free New Jersey for inviting me to be part of this wonderful panel, town hall organization. I have been waiting since March to be part of it, so I'm glad it finally came tonight. In addressing your question, opioids have been around for centuries, and only in the last 20 years have we really hit the crisis level. It's easy to blame the medical community since prescriptions are required for most opioid pain medications, with obviously the exception of heroin. In reality, opioids have been the fuel to keep physical and emotional pain and trauma at bay since the beginning of time. Additionally, overdependence on quick, simplistic solutions to keep our society functioning has kept the problem from truly being addressed. It's true that physicians were originally unwittingly pawns of the pharmaceutical industry from 1998 to 2007, believing that the claims of OxyContin were not actually addicting. And to make the situation worse, when OxyContin came out in the late 90s, the pharmaceutical company gave out coupons for 30 days free of the opioids to get people believing that this new type of non-addicting pain management drug would help them. When the claim had been falsely proven and dangerously misleading in 2007 to 2009, the old adage, the horse was already out of the barn. It was way into a crisis mode. When we finally had an opportunity, when this was unveiled to the public, to do something right, the Joint Commission stepped in, which is not an actual arm of the federal government, but a sort of regulatory branch of a nonprofit organization, and added pain management as one of the vital signs that physicians in both the emergency room and in private practice have to address when a patient comes in to see them. Vital signs being blood pressure, pulse, respirations, and your temperature are actual numbers that you can measure. When it comes to pain, pain isn't something you can quantify. Individuals have different levels of pain. Different people can manage different thresholds of pain. So what does that mean to us? By Medicare and Medicaid partnering with the Joint Commission, the doctor's hands were basically tied. They tied patient satisfaction and pain management to reimbursement. And that's a very dangerous combination. Hospitals and physicians were no longer going to get paid for their work and their care of their patients unless they met with the government guidelines of managing the pain at a level of 9 or 10 or better on a satisfaction score. So where do you go? The physicians are now in a very precarious position of trying to manage subjective pain and getting reimbursed. And since you can't truly measure someone's pain, you're caught in this conundrum. So under the watchful eye during this time that CMS and Joint Commission were working together between 2010 and 2015, the opioid and heroin deaths tripled. They first tried to quell this by changing the combination of the formulation of OxyContin so it couldn't be crushed and abused by addicts at this point to something that was basically inert. And what that caused was the drive toward heroin. And heroin became a huge player in the mid-2010s to 2015s. By 2015, over 220 million prescriptions had been written for narcotic opioids for pain management. Not pills, that's just the prescriptions. And in 2018, the estimated number of overdose deaths was 67,000. Compare that roughly to the flu deaths that year, 34,000, nearly double. So what should we do? Well, looking at the town in West Virginia, I don't know if anybody was familiar with it, they received over 20 million pills to a town with a population of 2,900. 20 million pills over a 10-year period. The federal government finally stepped in and said, whoa, we have to do something. And in 2015, the Congress stepped up and formed something called the PROP Act. And that's Promoting Responsible Opioid Prescribing. And what that did is try to unhinge the patient satisfaction, pain management from reimbursement. And each state from that point on went on to enact very, very stringent laws. With New Jersey, Governor Christie was one of the strictest laws that was enacted governing the use of pain medications by physicians, limiting it to a 5-day supply. Basically, if physicians wrote more than a 5-day supply, it had to be justified in writing with numerous documents, or we risk losing our medical license. Now that was pretty heavy-handed because people come in and they have various types of pain that need to be managed. And we were kind of left with, what do we do from here? So opioid misuse doesn't fall just on the sector of the healthcare system. And we can't address all of the major causes of prescription abuse. But when we work together with organizations like Hazlitt Hope, the Tigger Foundation, various different institutions, Robert Wood Johnson and Hackensack Meridian Health, with the community and various members in a multi-tiered approach, we're able to come together and combat this. There's a quote that I really like from the Surgeon General who said, effective integration of prevention, treatment, and recovery services across healthcare systems is the key to addressing opioid misuse and its consequences. This forum tonight, along with Horizon and Partnership for Drug-Free New Jersey, is a great way to bring all of us together to brainstorm on how we can work as a cohesive unit to address this.
Doctor, thank you very much. Freeholder Kiley, as the opioid epidemic has worsened over the past decade, how has it placed a strain upon municipal and county government and resources?
The strain has been tremendous. And we heard from Chief Whitkey already about the impact on law enforcement. Law enforcement and EMS in particular have been overwhelmed with calls as it relates to substance abuse and overdose, and require more and more manpower every year, or woman power every year, to be able to address this. Narcan, is on the market now, and it's a great drug to really help us bring these patients back, but it's also very expensive. So it adds to the cost of the EMS and law enforcement groups that have to purchase this and be able to have it available to them. There are other far-reaching impacts of this that you might not otherwise think of. For example, social services. Individuals with opioid use disorder are usually high utilizers of things like food stamp benefits, the housing benefits, finding shelter, using Medicaid, and getting general assistance. If they have children, there are going to be children's services involved, and we're going to have to be working with and helping families and children that are struggling because of a parent that might have an addiction. We get state funding in order to be able to support the programs that we put out there, and Monmouth County very generously contributes to those programs as well with additional funding and addiction services. But the need is always greater than the funding. Year over year, it's always greater than the funding. The funding generally increases year over year based on need. However, now we have COVID-19. And COVID-19 has had a huge impact, not only on reducing the funding that's available, but increasing the stress that people are under, and increasing the overdoses, and increasing the need for help. This year alone, as of August 31st, we've got 130 overdoses in Monmouth County alone. Last year at this time, it was about 115. So, again, it's a greater need every single year, and things like COVID and community issues or family issues that contribute to overdose only make it worse. We have an annual grant every year that we get for the prevention programs that we put into place. I think I heard somebody say Barbara Hilliard's on the phone, so she'll tell you a little bit about that. But for every $1 that we spend in prevention, we save about $5 in treatment. If we can get to people and help them reach out for help, we're in much better shape than when we find them in a situation where they need extensive treatment or housing or use of other resources. One other thing I want to say, that we just started an initiative called Stigma Free at the county level. And basically, we have several issues in the county that are fixable. They're very curable. One is people are afraid to come forward and say that they have a problem and ask for help. And that's stigma. And we can change that. We can change that by being stigma-free in our communities. So the county passed a resolution to be stigma-free, and we've now gone to the municipalities, and they, one by one, are passing resolutions to be stigma-free in their townships. We have Hazlitt just signed on. In fact, thank you, Chief, at their meeting last night. And they are now a stigma-free town, and we will continue to do this. The other thing we did was we had an addiction services, we had a behavioral health, and we had a mental health department. We rolled them all under one name, and it's behavioral health. And again, the goal is to make people realize that we want to be available. We want you to reach out, and we don't want you to feel uncomfortable that you're going to be stigmatized if you say you have a problem and you need help.
Freeholder Kylie, thank you very much. Mr. O'Hara, Phil, as a treatment liaison with Hazlitt's Hope, what part do you play in helping people who are struggling with opiate addiction?
Thank you, Pastor Barry. Thank you to the Partnership for Drug-Free New Jersey, Horizon, and thank you to Chief Whitkey and the Hazlitt Police Department, because without the Hazlitt Police Department, there would be no Hazlitt Hope, and there would be no intervention program in our town. So my responsibility with Hazlitt Hope as a treatment liaison is there's, I guess, several different areas of what falls under my responsibility. Number one is working with our lead recovery coach, Sean Plunkett, and Ellen Edwards, deploying out to the individual police departments. When they do have a person of concern under arrest, they call us out day or night, and we get out to the police department and we talk to the person in need. That would be the first part of my responsibility. The second part of my responsibility is figuring out placement for each individual that needs help, that's willing to accept help. Communicating with different treatment facilities, communicating with Christina Bloodgood at New Hope I cannot thank the ladies in the admissions department at New Hope enough. They have been one of our biggest supporters in helping get people off the streets and into a bed. And the third part of my job is maintaining our relationships with the individual police departments that choose to call us out. Again, thanks to Chief Whitkey and the Hazlitt Police Department, this is something that has gone from Hazlitt to several other Bayshore police departments, Keyport, Hazlitt, Homedale, Kingsburg, Union Beach, and I think I said Keyport, I might have repeated myself. And with that comes maintaining relationships with individual officers on the force. What's really been amazing in this process is seeing law enforcement through a new lens. It's no mystery that I myself struggled with addiction for years and was in and out of police contact. And you know, I didn't necessarily have positive experiences on my own until getting sober and working with these departments and actually seeing from the inside out that the police officers themselves want to see change. The police officers themselves want to see the individuals in front of them get help. They could see that these people are good kids. A lot of the younger cops of my generation are arresting kids that they went to high school with, that they grew up with, that they were friends with. So there has been a huge change, I believe, in the culture of the departments and actually getting help. And just a quick story that I want to tell because I feel like it needs to be told, especially in light of everything that's kind of going on in the news and the media today. So, you know, we had a case, we had a call out. An individual was getting discharged from the hospital. The ladies at New Hope were very quick to get him a bed. I was on my way taking him to New Hope and you know, I said, you know, where is all your stuff? And he said, oh, we can't get that. It's in an abandoned house in Union Beach. And I said, no, it's no problem. We could call the Union Beach Police Department. We have a relationship with them. And he said, no, we cannot call them. We cannot call them. I hit one of their officers last year and I was incarcerated for it. And I said, listen, just let's get you to New Hope. I promise you we'll get your stuff. We put him in. I called the officer that I have the most communication with Union Beach. I said, hey, do you know this person? He laughed and he said, yeah, he punched me in the face last year. And I was like, ooh. He said, well, listen, I just got him into treatment. His stuff's in an abandoned house. And he said, really? He's getting help? That's great. He was off duty this day. He said, meet me at the house. I'll be right over. I'm calling my sergeant. I met him and the sergeant, the off-duty cop and the sergeant at the house. They had made contact with the homeowner that owned the abandoned house. And this officer, who a year earlier was punched in the face by this person, helped me pack up his belongings, put it into a suitcase, and put it in my trunk so I could get it back to New Hope with genuine concern and happiness that this individual was really getting help. And that's in a nutshell part of my responsibilities for Hazlet Hope. Thank you.
Phil, thank you. Dr. Ridley, next question is for you. How aware is the school community of this issue? And in what ways have you seen it impact the school system and your own students?
Before I begin, I just wanted to give a tip of my hat to Freeholder Kylie. She and I, our paths cross often in these kinds of situations, and this is certainly an important one. I'd also like to acknowledge Phil O'Hara, who besides his vaunted role and his presentation is the son of one of my Board of Education members. So hello to Phil. And before getting to my answer, I want to show to you how important this is to me. I am a psychotic, unhealthy New York Yankee fan. They are playing a baseball game right now. They lose it, their season ends. But here I am because this is important and needs to be addressed. So that should declare my priorities to the people on the panel. Also, a tip of the hat to Coach Nucci. I know he's on board here as well. Our school community is very aware of the dangers of opioid abuse. And while we have not seen evidence, much of it, that our students are abusing opioids while they're in school, a good number of these kids have family members, friends, or relatives who have suffered from addiction or have lost someone they know and love. So in that respect, our students have absolutely been impacted. What I have seen in school is that often certain students miss that natural high that comes from competition, performing on stage, or getting your hand raised after peeing a kid in a packed auditorium. All too often when they graduate, that rush evaporates and they seek a substitute to take its place. And as we all know, some turn to pills and the false temporary high those products provide. So what do we do about it? Dr. Reynolds talked about this and Chief Whitkey talked about this. Education. Education is one such solution to this dilemma. And in Hazlet, we have been proactive in addressing this issue. Our health program follows the New Jersey Department of Education core curriculum standards for health and physical education. Students are educated on substance use and abuse, as well as strategies for coping, practicing resiliency, and acquiring refusal skills. Several programs and speakers from the addiction field, such as this forum tonight, provide information to our students as well. We have a student assistant coordinator who works confidentially with those who need help in dealing with addiction issues, whether for themselves, a friend, or family member. She provides information, resources, and support by working with the student, family, and service provider. She also works with county agencies to update information and connect with resources. In addition, we have student groups dedicated to getting healthy and sharing positive messages with their peers, either through segments on our morning show, on hallway bulletin boards, completing related academic projects, and even traveling to the schools of our younger students to relay their message and serve as role models. So yes, addiction is an important part of our conversation in the Hazlet school system as our young people come of age. With so many distractions and easy fixes available, it needs to be. Thank you.
Dr. Ridley, thank you. Appreciate the time. Next question, Ms. Edwards. Ellen, could you tell us about the difficulties that a family faces when a loved one is suffering through addiction?
Sure. Except I think that question is worded wrong. It should say, can you tell us about the difficulties a family doesn't face when a loved one, in my case, a child, is suffering through addiction? You wake up in the morning and that's the first thing you think about. You go through the day and you think about it all day long. You go to bed at night and that's the last thing you think about. It's constant. It is a constant thought in your head. But if I have to pick one of the most difficult challenges that I faced as a mother, is trying to save enough of myself for my other kids. I'm the mother of 5, and then my 2 oldest had addiction issues. My oldest daughter is in recovery, and my other daughter passed away. It'll be 2 years next month on the 3rd. But I still had my other family. I still had the rest of my family that I had to be there for. I had to be their mother. I'm a mother of 5. So when I got the call that my daughter passed away, you know, as a mother, you want to roll up and lay in bed and cry. But the challenge is you can't. You can't do that. You're a parent. You have to continue to parent. And that is probably the hardest, the most challenging difficulty that I faced as a parent. Thank you.
Ellen, thanks for being honest. I would like to get some more input from one other individual in this field who has helped put the town hall meeting together for us. Barbara Hilliard is the municipal coordinator for Hazlet, Homedale, and Keyport. Barbara, would you mind sharing some of your thoughts before we open up for additional questions?
Thank you, Barry. Can everyone hear me? Because I'm talking on my phone. Good. Okay. I just want to give a very brief overview of the statewide Municipal Alliance to Prevent Alcoholism and Drug Abuse program, which has been around for more than 30 years. We are really a good resource for our communities for prevention and education. Now, the Municipal Alliance is sponsored by the JCATA, that's the Governor's Council on Alcoholism and Drug Abuse. Also, we're sponsored by the Monmouth County Division of Behavioral Health and the Township of Borough that has formed an alliance. Alliances are supported by a yearly grant from the state and the county, and the state gets the money from drug and DUI fines to help them fund the alliances. All the alliances work closely and in partnership with local organizations and the local school district and their town. Alliances are dedicated to reducing the occurrence and impact of drug and alcohol abuse and to try and raise public awareness about substance abuse issues and develop and implement prevention programs and services in our communities and school. We also offer community support with information and referrals on substance abuse and related issues. Most alliances have a local office in their local municipal building. Now, we're very fortunate in the Bayshore area to have alliances in most of the towns. There's an alliance in Hazlet, Keyport, Homedale, Middletown, Atlantic Highlands, and Highlands. Now, just briefly, the Hazlet Alliance, which I'm the coordinator for, and one of the local sponsors for this event, we were formed in 1990 to help our community and its residents make informed decisions about alcohol and substance abuse. Besides our many education and programs and awareness programs, we also are there for assistance and referrals. And we offer, we join together. I work very closely with my SACs in the 3 high schools in the 3 towns I'm involved in to help form peer leadership groups. And also as another resource, in Hazlet, Homedale, and Keyport, I maintain an information 24 brochure display that I keep stocked. It's in Town Hall, our public library, the guidance office in Hazlet, in the middle school, and in the high school. And of course, all brochures are free to the public. I'm almost done. Now, as the Alliance Coordinator for 3 of the Bayshore Alliances, anyone can reach out to me for information or help. They can be assured that all calls are kept strictly confidential. I'm a certified prevention specialist, and I take an ethics pledge every year that I have to maintain confidentiality. In my 30 years as Hazlet Alliance Coordinator, I found that sometimes people are hesitant to reach out, either to the police, the school, community officials, and even to their friends. But they sometimes feel comfortable enough to seek out the Alliance Coordinator. It really doesn't matter who they call. We're all there to help everyone. And I just hope everyone remembers that help is just a phone call away. But the most important first step you can take is just to ask for help. Now, in closing, I would just like to mention there's two very important laws in New Jersey. One is called the Good Samaritan Law, which is the overdose prevention law, and the other one is the Lifeline Law that pertains to alcohol poisoning. These laws were enacted to save life. The police in New Jersey would rather save a life than arrest someone. So if you're around someone that is overdosing on drugs or even alcohol, you can do the steps, which is very simple, call 911, stay with your friend, and there will be no charges for the person overdosing and the person who is staying and being the Good Samaritan. Now, the Hazard Alliance has wallet cards that have these laws, and it has these signs and symptoms and steps. I will be putting them tomorrow in all of my displays. If you want to stop and pick them up, you're welcome to have however many wallet cards you want. I want to thank everyone. This has been we've all been waiting since March. And I want to thank all the panelists for taking their time and for all the information. And thank you very much.
Barbara, thank you.
Thank you.
For this part of our town hall meeting, we want to invite those of you who've joined us to become more directly involved. And I see some questions are already coming through, but if you'd like to direct your question to one of the panel specifically or the entire panel at large, just let us know as you write them in. One of the first questions is this, to Ellen and the panel: how would you recommend a community help a family that has a member struggling with addiction?
Education. You have to educate the parents, the community, because the stigma is what's killing people. If we don't break through the stigma, we're never, ever going to help the suffering addict.
I could add to that by saying that when you come into the emergency room, to make sure that we provide a judgment-free zone, that we provide no moral guidance. It's not our place to be morally guiding people. It's our place to help them heal and to help them recover. And that will, in my experience of 20 years, that has provided a much greater turnaround than any other intervention.
Thank you. Any other input from the other panelists on that question?
Just one more thing, stigma. You hit it right on the head, Ellen. People have to feel comfortable to come forward. And I think our biggest challenge is helping everyone understand that this is a disease. You know, if I came to you and said, I have diabetes, you'd give me 10 places to go for help. But if I come to you and say I'm an addict, the reaction is very, very different. And that's what we have to change.
It's very true.
Next question is for Dr. Reynolds specifically. You had spoken about the 5-day limit. Can you talk about the benefits of some of the other New Jersey laws, in particular the requirement that patients be notified of the potential for dependency and addiction of the opioid if they're prescribed? And has there been any change in patients' attitudes towards opiates during this time?
So surprisingly, a lot of patients don't want the opioid for the pain. They want something else. They ask for an alternative, or they ask that the prescription be as little as possible, and can we recommend another intervention? New Jersey has been pretty aggressive, and when the laws first changed under Governor Christie back in 2015, 2016, a lot of physicians bristled at these changes. Mandatory education to every patient on addiction, other choices for pain management. We have to document those in our chart. We also, there's a regulation that we have to do a search on every patient that we write a narcotic prescription for to make sure that there isn't an open prescription out there already. There's another one that's a limit on, we can't write more than 2 prescriptions in 365 days for acute narcotic pain relief without a pain management specialist intervention. Now that's been met with quite a bit of pushback by a lot of providers. You fall in January, you break your ankle, you have a kidney stone in July, you have back strain in October, and now you've reached your limit of pain medication for the year. But the safety that's built in there is tying into the primary care doctor. Patients, when you discuss with them honestly and openly the risks of the addiction, they're much more willing to take, you know what, doc, just give me 6 pills, just enough to get through this until I can work on a different avenue for pain, or I can get to a specialist that can help me manage it better. They're much more willing to work with us than I think the general population believes. There's not as many people coming to our door these days saying, I need a 30-day supply. That doesn't happen anymore.
That's good to know. Thank you. Next question is for Dr. Ridley. Do you think it would be helpful to have a specific opioid misuse that could happen with a specific class of athletes who might get injured? Also, is there a discussion of alternative pain management without opioids?
I do, and I think we do. We have health classes which are informative of this kind of situation. We are partnering with the Hazle Township Police to bring them in to do presentations on a regular basis. Phil has been to our school several times, told his own stories to captive audiences and who hung on his words. They're powerful. And, you know, as a school administrator, the word to me is conversation. And you heard Sue say it before as well. You don't sweep this away. You don't ignore this. You don't pretend that it's something we can't talk about. These conversations have to happen often, and they have to happen in depth, and they have to happen with an array of stakeholders involved. And only that way will we get out the word in terms of, hey, it's okay, we're here to help you, and we're gonna fix it. And if we have to put you in a classroom to tell you how to fix it, we'll be more than willing to do that as well. I also know that all of our varsity coaches talk to their kids during their athletic experiences on teams, and what to watch for and what to avoid.
Thank you. This is a related question, and perhaps you've both already addressed it, but for both Dr. Ridley and Dr. Reynolds, do you think it would be helpful to have a specific opioid misuse education that can happen with athletes who might get injured?
I defer to the medical doctor.
Fair enough.
Absolutely. Whenever we have high school athletes arrive at the hospital or arrive in an urgent care center or a primary care doctor's office with an injury, first of all, under 18, we're mandated to have a conversation with the parents. Whether they're an athlete, whether it's a motor vehicle accident, anytime we're prescribing narcotics, we have to have the conversation. But I think that encompassing an opioid and pain management abuse, misuse with any seasoned athlete, like Dr. Ridley was saying, every coach should be responsible for it. And every physician working with any kind of athlete, sports medicine, orthopedics, internal medicine, emergency medicine, need to be very well versed in the conversation and not afraid to have that conversation with the parents and the child about pain management and alternatives.
Thank you.
Something, if I could chime in, also, you know, I've spoken specifically. The Homedale football team had me come out and speak to their kids before the pasta night, which was really awesome. I think there's several different specific breakout groups that we could and should be talking to our kids about. You know, we should be talking to the athletes about the injuries and stuff like that. But I think a hugely underserved population that we don't tend to think about, and I didn't really think about it until I started going into the schools with Michael DeLeon and Steered Straight, and I've gone across the country, and this is really the first generation of child who is dealing with substance abuse as the child. A lot of our kids across the country are living with grandma and grandpa. A lot of our kids across the country have lost a parent to an overdose. And, you know, there's a tremendous amount of pain, shame, guilt, and trauma that is permeating through our school systems in our children. And, you know, it's amazing to me that, you know, a couple of tattoos and a bald head, and I can come in at 32 years old and have the kids say that, you know, you're not a teacher, I could talk to you, and be there for an hour and have any kids come up to me and open up about stuff that they're not talking about to anybody else. And the truth is, and the sad truth is, from my experience inside the schools across the country, not just the Bayshore, there's a lot of kids in our schools that are hurting. This is the first generation that has grown up with social media in middle school. There's a lot of bullying. There's a lot of, there's just a lot of stuff going on with our children that is the first step towards addiction way before they will ever put a drink and drug in their body. And yeah, that's all I have on that. Thank you.
Thanks. This is probably more directed towards those of you directly involved in Hazard's Hope, but the question was, how many people has the crisis line helped?
I saw that in there, and luckily I was able to send a text message to get the exact number from our treasurer. We have helped 64 people into treatment facilities. Luckily, with our relationships with the different treatment providers, last year alone at our fundraiser, we got 13 treatment scholarships donated, from detoxes to full inpatients. That was in one night. We got 13 scholarships. Since 2017, when we really launched the program, we have placed over 25 of our indigent patients in private treatment facilities. And I really need to thank the different providers: Discovery Institute, Footprints to Recovery, Seacrest Recovery Center, Blue Crest Recovery Center. That's just off the top of my head. I know I'm forgetting Agape Treatment Center. They donated 5 scholarships. Sunrise Detox has been a huge help. Princeton Detox has been a huge help. We've really seen just a tremendous amount of support from the different providers to help us handle our workload of people that need help. And again, the ladies at New Hope that have always been really, really amazing at getting people in.
Thank you. For Phil and Ellen, more specifically, having lived through this much more personally, what are some of the most difficult barriers that you faced on your journey?
Ellen, you want to go first?
The shame as a parent, you know, feeling like people are looking at me as a failure as a parent. Like, I think that's probably the most difficult thing for me, but it can be changed. Once I started talking about it and realized that I'm not alone. I'm not the only parent who has felt the shame of having an addicted child. So once I started speaking about it, I broke through a stigma. I broke through the stigma for other people to come and ask me for advice or ask me how I dealt with this. And we would talk back and forth, and we'd break through the stigma together. And that's probably the hardest thing in the beginning. When I first found out my daughters were both using, was the shame that I felt. Phil, you can probably talk more about how you felt.
So if you would have asked me in active addiction what my biggest barrier was, I probably would have given you a different answer than what I'm going to give you now. But having recovered from heroin addiction and looking back and having a clear brain and kind of an overview look of my years in active addiction, the biggest barrier to my recovery was myself. For so long, I thought it was the world. I thought it was specific people in my life that, you know, just everything was against me. I thought I could do it on my own. I thought because I was a wrestler that somehow I was weak. But if I you know, got help, then I was weak and I could do this on my own. And I fought on for years trying to do it my way. When, you know, the first time I stepped into an AA and NA meeting, I was trying to figure it out. So I was doing both. I was 23 years old, and there was people inside that meeting that, had I understood what they were trying to say to me and I'd listened to them, I could have shaved a lot of years of pain off of my story. However, I fought on doing it my way until my way did not work anymore. At 28 years old, I was just beaten, battered, and broken. I was just tired of what I was doing. The drugs were no longer working. They were no longer making me feel good. They were just inflicting pain in my life. And finally at 28, I asked for help. And when I got into treatment for the first time, I had gone to a detox prior, but when I finally got to treatment, I was just told, by the guy that got me the scholarship, just do what you're told. And I held on to that. And when I got out, getting a sponsor suddenly seemed like a good idea, where all those years it didn't really seem like a good idea. Going through the steps sounded like a good idea, whereas, it never sounded like a good idea. And honestly, we need to stop calling treatment centers and start calling them separation centers. Some people aren't going to like what I'm saying, but I don't go to treatment and get cured. I go there and I get separated. I get the first 45, 60, 90 days separated from my drug that I could not get on the street. I work on those severe underlying issues that I have, but when I leave that facility, it's up to me to continue that progress that I developed inside that treatment center. And once I got out of my own way, and I understood that when I got out of treatment, I needed to accept help and find mentors and sponsors and change the people that I surrounded myself with and remove negative people and replace them with positive people. That's when my life started to change. That's when my mindset started to change. I went from feeling like I would never be able to own a home to flipping it to like I'm going to own whatever home I want, and it was really that psychic change. So I was my biggest barrier.
Appreciate that. To the whole panel, what programs are available in the community for prevention and recovery support, government or faith-based, or other options?
Well, I can just tell you from our vantage point in the healthcare, there's a plethora of programs available. But to take one short step back to what Phil was saying, we get people who come in multiple times overdosing, multiple visits for the same thing. And until they're ready and until that light goes on and they've hit that bottom, that's truly their bottom, not their parents' bottom, not their friend's bottom. Once they've hit the bottom and they're ready for the help, our emergency department, Monmouth, Central State, New Brunswick, all of those emergency rooms are very well equipped with referral services, social workers who are in place 24 hours a day to give help when it's asked for. And the community that I work a lot with, Tigger and with Hazlitt Hope, and I know that the resources are there. So I share a lot of my knowledge with patients when they're ready. And when I come into the room, when they're ready, when they're not ready. You can provide them with information and they're going right out the door. They have to be ready or it's a waste of everybody's time. And it creates this where the patients feel judged, and you don't want them to feel judged. You want them to feel ready. You want them to feel open. You want them to feel almost like a blank slate. And when they're at that point, that's when Hazlitt Hope comes in, and Discovery House and Tigger, they can come in and help people. And I think that having a list of resources so you can tailor it to the individual that presents. This resource may not be good for this person, but wait, we have this one over here. And I think that's the most important thing, is to have multiple resources available.
If I could also chime in, thank you, Freeholder Kylie, because this year the county has gotten behind a Boots on the Ground initiative. It's a grant with Robert Wood Johnson. The Barnabas coaches are now deploying out to Highlands Police Department. It is they're offering not just deployment to the person of concern to get them into treatment, but they're offering a wraparound case management service. And they are following up with the people that they come in contact with for several weeks. I know that there's a lot of great programs in the county. CFC, I know, is a great resource. They're doing a lot of great things, kind of more centrally located in the county. Ellen, I forgot to thank you guys and Veritas when I was talking about the different providers that have been helping people get in. I'm sorry, I'm on the spot. But Veritas is a great resource. Locally, Recovery Centers of America just opened their Sayreville location. Sunrise Detox has several locations in the area. Seacrest Recovery Center is in the area. There is a wealth of options in the area. CPC is another great resource for outpatient services. I was on a recovery collaborative meeting this morning, and it was much like this. And it was different providers, different coaches with Robert Wood Johnson, and what's really awesome, and we're just really seeing it this year, is there's been all these great organizations popped up all over Monmouth County. And I'm really noticing this year that we're kind of really coming together and getting on the same page and creating this web. And it's really going to help people not fall through. The fact that everyone's on the same page looking to help one another. The call that we were on today was great. People were offering advice on different cases, or people that we're following up with. Just it's really amazing what we're doing in this county and how we're working together.
Just, I'd like to add on to that. Monmouth County did a needs assessment of our county and our residents 2 years ago. And from that came a program called Monmouth Acts, ACTS, Assisting Communities Through Services. And for the first time, we have a partnership between private entities and government entities. And we all work together in one big network so that we all know about each other. We can all help each other. And we have Monmouth Act's website, which has a very robust list of services and service providers if anybody needs them. But, you know, we coined the phrase no wrong door. So what Phil is saying, you know, we're all collaborating, we're all talking together. So if someone happens to walk into a financial center because they need help with their taxes, but in the discussion says something about their child that they're worried about that has addiction. Now, because we're all part of one network, that person and that entity can refer them to the right place for all of the issues they may be facing, versus the one thing they came in the door for. So there's no wrong door to get the help you need.
Thank you. To go back to what Dr. Reynolds and Phil had just mentioned a moment ago, this is the same type of thing that we see within our churches. It's until a person comes to the point where they see themselves as they are and are at that point where they're ready for help is the first place they get to see that there's somebody else looking out for them. And the love of God is powerful and strong and is always available for those individuals who are looking for a new life. And so on that, I would like to turn things back over to Angela, and thank you again, the panelists and those who have asked the questions. I appreciate you being with us tonight.
Thank you so much, Pastor. And thank you again to all of our panelists. I appreciate everything that you shared with us today. Really, your comments were so well placed and really helped to move that conversation about the opiate crisis along. Dr. Reynolds, I'm so pleased your answer specifically about some of the New Jersey prescribing laws. So proud that the Partnership for Drug Free New Jersey actually authored that patient notification bill that you spoke about. So great to hear that it is making people think twice before taking an opiate and looking at alternatives. So thank you for sharing that. Thank you again to all of our attendees. Thank you to our panelists and Pastor Barry, excellent job moderating, so really appreciate that. Thank you to everyone who is on, and there'll be information in the chat. I think we're gonna have a survey pop up, and you'll be receiving one via email as well. I wanna thank you all for participating, all of you for helping to address the opiate crisis in the Bayshore community. Thank you again, everyone, and be well. Have a good evening.
Bye.
Bye.
Bye.